Welcome, senior seminar class, to our presentation on what are the best strategies for practitioners in combating non-adherence to physical lifestyle changes. I am Riley Bennett,
I'm Isaiah Blok.
and so how this strategy relates to me in my future occupation is I'm hoping to become a physical therapist, and a major problem in physical therapy with effectiveness of treatment is the ability for their patients and clients to adhere to the exercises that physical therapists have given them to do on their own that will help complement the exercises done during the sessions with the physical therapist.
And I have an interest in public health, and a big issue with public health is non-adherence. Um, to keep the public safe, basically, and keep them all healthy. And non-adherence would put a lot of people at risk rather than just a singular person. So, yeah, it's kind of a big deal in the public health field, actually. So, um, yeah, we're going to talk about what adherence is. Adherence basically implies that people freely choose to undertake behavioral plans, have input to them, and have collaborative involvement in developing and adjusting their plans. And a lot of you are probably wondering if adherence is really a big problem here in the United States or in our specific fields. And studies show that U.S. adults adhere to the physical activity guidelines only about 53.3% of the time, which is not very high when you really think about it. And only 35% of people are fully adhere to their physical therapy at home protocols, which is, I mean, a major percentage of them not adhering. So it's a big issue, and we're going to attack it from two main approaches. The first being a facts and logic approach, and the second one being a good client practitioner relationship.
So, approach one, facts and logic. The main things this approach wants to do is increase awareness and knowledge for uh, the client and the patient. The main way to do that is bring awareness to the need of change. This is like having someone go get their blood work done to see their blood lipid levels or their blood glucose levels after fasting, and if these are like way out of range and not lining up with the health standards, it's showing to them you need to change because of this. And if this continues, research has shown this is what results. Like this disease can start to affect you, and you can have this decrease in quality of life. They really try to get the client to understand what is going on and why they need to change. With that, they think knowledge is power. So they want to bring awareness to the client of everything that happens during the process. Like for me, for rehab, is like what happens when someone is dropping out of a cycle of doing well, and like how do you combat that lack of adherence and notice that cycle beginning. Because it's been shown that there's a cycle that once you've done it once, it's easier to fall back down in this downward spiral. So like how do you attack that? So as I've been saying, education of the client is very important. They think it helps normalize or helps it not just seem like it's their problem. If there's stats on it, they obviously have other people dealing with this, so they're not alone. And then this this way of doing it has been shown in the review done by Efron and Clayton to show that with acute disease and injuries, it's really effective because uh, they start to see the changes sooner than like if it was a chronic disease or a chronic uh, injury. So this strategy really works well in that scenario.
Our second approach is having a good client practitioner relationship. Obviously, when you have a good relationship with someone, you're willing to share more things with them, and one of those things is blame. And practitioners have a tendency to not share as much of the blame as the clients. Um, they think that it's like on the clients to as to whether they adhere to their regimens or not. Um, and yeah, just increasing the comfort level you have with your client, um, coming across as a helper and not a judging dictator is a really good way to help facilitate them and help them to understand what it is they're supposed to do. And increasing your communication skills can also increase in adherence because it'll make it far more clear as to what you want them to do. And a lot of the time, patients fall into non-adherence because they don't understand what they're supposed to be doing. And the best way a practitioner can avoid non-adherence is by making it explicitly clear as to what they're supposed to do. And having a good relationship can only benefit both the client and the practitioner in this case.
Yeah, so then those are the two like approaches that we saw when we were looking through stuff of like how people normally go about approaching this issue. And then we, through our discussion and reading our papers, we thought of these ways to bridge the gap, or these are like our conclusions of the best ways to combine the two approaches for effective treatment or effective adherence to our lifestyle changes. So they are teaching how to cope with relapses, which we'll go in depth about, keeping it enjoyable and interesting, understand and deal with personal barriers, and then take personal responsibility. So the first one is teach how to cope with relapse. So relapse is when someone is doing well, adhering well to what you have prescribed to them, but they miss a day or they mess up with one guideline. Let's say in Isaiah's field or in mine, it'd be like not doing all the sets of their exercises. They just begin to lose some of the willpower, you say. Um, First, it's for us as practitioners, it's like teaching them how that it's a normal like it's a thing that occurs regularly. No one ever really completes something 100% all the way through. It's very hard to do that. So then once they understand that and that relapses will happen, that allows you to then discuss like how are you going to deal with that when that occurs in your treatment plan or when you go through your style walk, like a life walk. So an example would be like for if Isaiah is giving a public health announcement of people trying to help them eat better, and like this guy doesn't eat well on the weekend, how does he deal with that relapse so that he doesn't go in that downward spiral we talked about earlier? And yeah, that's a big thing. And then through that, you can build a better relationship, which is a really important part of. So then with this, you want to make sure you guide and don't steer. The Glarus article talks a lot about it. It was a research article on variety. So there's an exercise, 3 exercise groups, and the one that did less had more variety but guided than the group that just did whatever they want adhered better to the exercises. So with that, it was kind of like implication of you don't want to just give them everything. Like you're a practitioner, you are supposed to be an expert in this field, but you also don't want to just suffocate them and make them everything is up to you. And yeah, you want to be guiding them along the path of towards health and not just yanking and pulling them. And then a big part of that is setting realistic goals while building relationships with them so that the goals are something they want and not something you want for them.
All right. Another conclusion we drew from these studies was we could keeping it enjoyable and keeping it interesting is important. As Riley said before, in the Glarus study, there were 3 groups. One of them had a variety of treatments and was guided, and the other one um, didn't have any guidance whatsoever. And it was quite obvious that the adherence level in the guided variety had the highest adherence rate, um, and the one without guidance at all had the lowest adherence rate. And that's a lot of just accountability, just coming up with different regimens that people are being held accountable to because you're guiding them and, like Riley said, not steering them. Um, another thing is just do what they like. Obviously, people aren't going to do what they don't like to do for very long. It just becomes long and grueling and monotonous, and yeah. So, and then utilizing positive peer pressure is another very constructive tool that you can use. It's found that when in a group of like individuals going through similar things, there is a stronger adherence to whatever that regimen was, and that's again is with the accountability. You have other people that you know are going through the same thing and that are there if you need them to ask for help or something like that, and people who understand what you're going through. It makes it a lot easier for them to adhere to said protocols.
The third conclusion we got based off our reading and understanding was understand and deal with personal barriers. Personal barriers can be anything from, as here, like cost of treatment. It could be depression, anxiety. It could be pain. It could be like lack of social support. All these other factors that they have been found. But we have to understand with that the reason for their non-adherence isn't usually just that one thing. It's usually each individual has a specific set of barriers that they are coming into the situation with. So when you're getting to know them, like we really think the approach 2 is very important in this part of it, where you're trying to get to know the individual and like see their personal struggles and like why aren't they wanting to change and why aren't they wanting to adhere to what you're doing, and like what are their barriers for that. So that's a really important thing to understand for us as practitioners, is there's um, a lot of non-adherence is multifactorial and involves a lot different things for every person, and you have to individualize for the personal situation that they're feeling. um, yeah, a main one that we thought was pretty evident was the cost of treatment. uh, so this is the one that throughout probably was the one that was, if you could take one factor that was consistent with most situations of non-adherence, this would be it. If they didn't have this, it was harder for them to adhere. Like they didn't have the money for a program to get to a gym to adhere to the program, or they didn't have the money to pay for physical therapy, or the money to get maybe bands to do certain exercises at home. Like that is a big idea. So figuring out ways to work around that big barrier is something practitioners need to be more aware of. And then, yeah, obviously you got to get to know your client and their situation, as I said earlier. So,
All right, another thing that's we found to be very important was taking personal responsibility, especially when you're a practitioner. Around 75% of practitioners take zero responsibility for a lack of adherence to their or in their patients, and it's just important for practitioners to realize that they're also part of the problem. It could be that they don't give clear enough instructions, like you said earlier, or like stuff like that, like things where the client just doesn't understand what they're supposed to do and the reasons why they're supposed to do it. So it's important for practitioners to take a little bit of that responsibility upon themselves and yeah, just make themselves better to try to reach their clients in a way that will help them to adhere better to their instructions.
yes, thank you for listening to our presentation. Here are our references. And do you anyone have questions?